February is Eating Disorder Awareness Month, a time to shine a spotlight on a health issue that affects far more people than many realize. In fact, an estimated 9% of the U.S. population, or 30 million Americans, will experience an eating disorder during their lifetime. But experts say misconceptions and stigma often prevent early intervention and treatment. Steve is down in the ARC Lounge with Dr. Natalie Goodwin, the Regional Clinical Director at the Eating Recovery Center in Seattle. Steve.
Doctor, this is such an important topic, and I'm glad that we're raising some awareness about this morning. Thank you for coming in. I'll be honest, I had never heard of this center before. And for people who are like myself, what do you guys do?
Yeah, so we have a facility in Bellevue. We also have some other facilities around the nation, but we offer residential partial day hospitalization, which is basically full day treatment, and intensive outpatient services for anyone who is 8 and up who is struggling with an eating disorder.
8. Mm-hmm. Very young.
Yes.
Very young. I know that Tyra had mentioned a pretty staggering statistic in the introduction, but in terms of what we see locally, how big of an issue is something like this? What do you see at the center?
Sure. So what we've really seen is, when COVID started and sort of after COVID, we've definitely seen an uptick in the number of eating disorders, especially in kids. And then, locally we have often a lot of people from the Seattle area at our centers, but also from all over this region who are just looking for help. So, what we tend to see is, the winter months can be sort of dark and gloomy, and a lot of times that's when people's mental health struggles tend to get exacerbated. And so it's an important time to be checking in on your friends, your family, the people that you're in connection with, and looking out for the different ways that they could be struggling.
Why do we think we're seeing an uptick since COVID?
I think during COVID, a lot of our kids were really struggling with what happened with the schools and lack of social support and different things like that. We're still, trying to understand all that happened during that time for the kids, but we definitely saw upticks during COVID. And, once people kind of got back into their lives, I think they were really excited about that, but then, we're starting to see things pick back up again.
I have to imagine that there are myths or sort of misconceptions that are out there about eating disorders. What are some of the top 3, let's say?
Yeah, so I think the first one would be that you can sort of look at someone and tell if they have an eating disorder. And that's just a really erroneous way to think about it, because eating disorders come in all shapes and sizes. You can't look at someone and know what's going on for them. So that would be the number one. The number 2 would be, that this only happens to a certain type of person. What we know is that there are eating disorders in men and people with all different types of identities that are trying to work through different emotional issues in their lives. And so you can't sort of go by a specific demographic or a specific identity and say that person is more likely to have an eating disorder. We also know that BIPOC folks, so Black, Indigenous, people of color, they are 50% less likely to be diagnosed with an eating disorder while they still also have those eating disorders. So we don't do a good job of assessing those folks when they're coming in for care from their doctor or being seen maybe for the first time by someone.
And you had mentioned something that I was sort of curious about too, is how big of an issue this is for men, which I don't think gets talked about a lot.
Sure. Men don't talk about it as much, and it sometimes flies under the radar. So I think that would be myth number 3, is this just isn't just female identifying people. This is 25% of men as well.
If you suspect that somebody is having an issue with an eating disorder, I'm sure for somebody in that position who suspects it, the tough part is figuring out, okay, how do I help that person, or how do I connect that person with someone who can help? Is there a first step that you can take, or a couple of steps that you can take to try to connect that person or get that person some help?
Sure. It can be really tough because unlike some other mental health diagnoses where people really want the symptoms to go away, an eating disorder can be held really close to the heart because it's really helping someone adapt and function to whatever's happening in their life. And so there can be a tendency to kind of keep things hidden or not want to talk about them. So what I always tell people is the number one thing to do is really express care and love first, and then express concern. And sometimes those conversations have to happen over and over until somebody, really is kind of open to hearing the concerns of others, but really sticking with those conversations, and then also knowing who to call. So we offer free assessments at our company at Eating Recovery Center. There's also a lot of resources on the web, National Eating Disorders Association, and so looking at some of those resources and figuring out how you have those conversations. And then if you're a parent and you have a kiddo, making sure they're getting to the doctor, making sure you're getting them set up for mental health services, a therapist, sometimes psychiatry, dietitians, those can be really helpful conversations to have. So really it's about expressing that concern, really trying to help someone connect to what really matters most in their life, and how maybe some of those eating disorder symptoms can interfere with that, and then linking them up with providers.
As a wider society, is there something that we can do to help the situation? What is that?
So it's an interesting question, because what we know is that with eating disorders, there's sort of a 40% genetic heritability rate. So that basically means there's some biology underpinning things.
Right.
But then as someone's going through life, they experience trauma, they're surrounded by a lot of diet talk, or what we call fat talk, that really produces a lot of shame about someone's body image. We know that sometimes anxiety can turn into manifesting with eating disorder symptoms, depression. So there's kind of a whole host of things that can really impact how this develops over time. But I think really as a society being mindful, how do we talk about our bodies? How do we express gratitude for them? How do we notice them for more than just what they appear? And how do we help other people feel comfortable in themselves when we're having those conversations with each other? And really just remembering that mental health needs to be paid attention to. So teaching people about mindfulness, teaching people how to understand their emotional experience, and having some ideas of how to cope can be really helpful.
That last question can probably be an entire conversation by itself. Right? I mean, there's so many factors at play. Social media I was thinking about too, and the impact that can have on this issue as well.
And especially if I can just chime, like when someone is using social media and comparing themselves to the images they're seeing, that's really when we notice that it has quite a big impact.
Which a lot of people do all the time.
Editing photos, all of that stuff.
Yes, all the time. An important conversation. Thanks for what you guys do.
Absolutely.
And
Thanks for having me.
In
for
and
sure.
certainly raising an awareness about an issue that affects so many people here locally, Tyra.
Absolutely. Yeah. Thanks for that interview, Steve.